Hi everybody, how's it going? Coming a little bit early today on Saturday to our little live broadcast. Wanted to thank everybody for the last couple of months of hanging with us while we were not able to operate, but we've been back, and this week's been a great week. Operated every day, which was really fun. Today's Saturday, even did a surgery today, trying to accommodate all of our patients who've been waiting patiently, and just been really great to work with. It's been really a great experience seeing how committed patients are to our practice, and hopefully we're able to pay that back. But we're just wanted to recap a great week of surgery. I think we did, oh gosh, we operate every day, so probably 10, 12 cases easily, maybe more.
Yeah.
Took care of some great patients, kind of did everything we like to do. So it's been really exciting. Going to have tomorrow off, but we're back at it next week. And thanks for the questions. Always some really good ones. So we thought we'd take a few minutes to answer some questions. Before I do, in case you're curious what some of you guys maybe seen on my feed that I like to run, and I've been trying to get better at it. One of the best books, maybe the best book I've ever read for running training is this one. Put that up there for you guys. Training for the Uphill Athlete. There's a runner, one of the authors is a guy named Kilian Jornet, who's a Spanish runner. If he's not the best high altitude endurance runner in the world, he's got to be in the conversation. It's pretty fun to see what he's able to push his body to do. But great stuff. If you ever have a moment you're interested in that kind of thing, pick it up. It's a really quick read, and it works. So let's talk about some questions that we got. Let's start with a question from Jamie Nickel, who asked, do we do lower leg lipo? Absolutely. One of the most dramatic areas for improvement with liposuction is kind of the calf-ankle junction, cankles as some people call them. You can get a really incredible result. I've had women come in who say, I don't fit comfortably or feel comfortable when I'm wearing like boots. It just feels really tight in that area. And then we can really sculpt it and narrow that junction so you have a nice transition from the calf above down to the ankle below. The key to that, in my opinion, is to not liposuction over the calf itself, over the muscle. I've seen patients come to me, unfortunately, who've had that done elsewhere, and what happens is the skin can really ripple sometimes. It looks pretty awful. But the junction below that, yeah, absolutely, we liposuction that all the time. And there's some photos on our photo gallery under the liposuction section that show that those results. Let's see. We have a question about scarring after a breast lift from Gate Z. And what are the prevention and care tips? So we go with all of our patients, we go through a bunch of different things that we do during surgery, and also have you do after surgery to help improve scarring and reduce it. The hard truth about it, though, is that a lot of scarring really comes down to the patient's genetics. Some folks just make a really bad scar, no matter what the patient does or the surgeon does, and no matter the part of the body, they're going to make a scar that's not so great. Thankfully, that's pretty rare, and it's pretty rare on the breast. Typically, if you're going to have a bad scar, the places in the body that can create a bad scar are like the shoulders. You may have seen some folks who've had even a vaccine shot, and they get a really thick scar there, or the center of the chest. But on most folks on the breast, the scars tend to do extremely well. No scars disappear, but they become pretty hard to see with time. We have a question from Aaron's Finding Muchness. I like that. That's a good name. I think I said that right. About how is pain managed post-op, and do we recommend lymphatic massage? So we do what's called a non-narcotic pain management protocol for all of our patients, where we do some medications prior to surgery, we do some long-acting numbing medication during surgery, and then several types of medication after surgery, all to hit the pain pathway at different points in time and at different points along the pathway. And we're certainly happy to offer narcotics to folks if they need it, but the truth is most patients with this protocol don't need it. Even bigger operations who kind of have a reputation for taking a lot out of a patient, like tummy tucks. You may have read online or seen or had friends who years ago had a tummy tuck, and they feel like they were just hit by a truck, like they're really down for a week or two. Thankfully, with this protocol, it tends to work pretty well. Occasionally, folks still need some narcotics for a day or two, but most patients don't, and they're not as kind of groggy as they would be with narcotics.
And not constipated.
And not constipated, right. So that's a huge deal. Narcotics make everybody constipated. So not putting those in, not giving them after surgery really makes a big difference for folks' comfort post-op. So huge change we've seen with that as well. And then I have a question about what's the recovery like. This is from Julie Falsetta. I think I'm saying that right. Recovery from a mommy makeover. Yeah, I mean, it really depends on what is going to be involved in that. Typically, I tell folks to plan on a couple of weeks off from work or from any major responsibilities at home, and then 6 weeks off from working out. Most folks are feeling good and ready to go prior to that 2-week time limit, but I want everyone to be cautious with it and not have to do too much too soon. I actually think the riskiest time after that operation is the second week, not the first week out, because the first week you're kind of sore still and your body's kind of telling you don't do too much. But in that second week, what ends up happening is you start to feel really good. And then, if you have stuff to do with the kids, if you have stuff, from work or whatever, you're going to feel like you can do more, and that's how you can get into some trouble with overdoing it. So really 2 weeks, I think, is a safe bet in terms of giving yourself plenty of time to recover from that. Another question, this is from Romina Stanford asking, what's better, teardrop or round implants? Every surgeon has their preference. In my practice, we almost always use round implants. The reason is, and I think we touched on this in one of our other live sessions a few weeks back. The whole idea behind a textured implant or behind a teardrop implant is to give you a more natural look. In my opinion, as long as the implant's not too big and it's not overwhelming your frame, overwhelming the breast, you're going to get a really beautiful natural look with a round implant as well. And the round implant, if it turns or spins, it doesn't matter because it's round. But a teardrop implant, if it spins, then the fullness is no longer at the bottom. It can be on the sides, and that requires a reoperation. That's why the manufacturers texture that teardrop implant to try to keep it from moving. But some patients can have some problems with that texturing down the road. Not right away, but years and years later. So it has to be a really, really compelling reason, in my opinion, to use a textured implant today. Now, again, just to be clear, there are some surgeons that are going to have really great results with textured implants, and they're going to think differently about it. But for me, almost every patient that comes in is going to do pretty darn well with a smooth round implant. Did I answer it? Is there a question there I'm supposed to answer?
There is.
Yeah.
Can you talk about a tummy tuck without the drainage?
Yeah, I think what you're meaning is maybe without drain tubes. Yeah, so I used to always exclusively use drains for the tummy tucks, and what I've learned from colleagues, from some studies, but also just from experience now, is that you can get a really nice result and lower risks of problems without the drains. And we use what are called progressive tension sutures. And so what that means is, I'll kind of break it down. We used to, when we're doing a tummy tuck, lift the skin up, tighten the muscles, pull the skin down, remove the extra skin, put drains in, and close the incision. So there's a space there where the skin has been lifted off the muscle. And that's where the drains are in, and the drains are designed to remove any excess fluid that would naturally accumulate. But the problem is, even when we waited for the drains to really put out very little fluid, in a lot of patients, they would get these little fluid collections called seromas, and that's a real annoyance for the patient because we have to see them again and put needles in there to drain the fluid out. So we started using what are called progressive tension sutures, and they work great. And the idea is, as you're pulling the skin down to remove excess skin, once you remove the excess skin, instead of just closing the incision, we actually tack the skin down as we're setting it down. So almost imagine kind of layers of quilting of the skin. So there's very little space for any big fluid accumulation to occur. What's nice about that is we don't see those fluid accumulations like we used to, very rare. And we seem to be able to get out more skin than we were previously. So it's kind of a win-win. On some patients who are really, really thin, you can see a little bit of a dimple of the skin from that skin being set down with those sutures. We obviously don't leave it like that during the surgery. If we see that during surgery, we take that out or replace the suture. But the good news is, even if that occurs, these sutures are dissolvable. So over the first 6 weeks, they should dissolve and they should smooth out with time. And there's always some things we can do if it doesn't. So on balance, I think it's a superior result versus using drains alone. Some patients will actually do the progressive tension suture and put a drain in just as a backup, but that's sort of a case-by-case basis. I hope that answered your question. Let's see. And how about, there was one about, do we remove moles on the face? We certainly do. One thing to keep in mind, though, is that we don't, usually that type of thing would be covered by your insurance, certainly if the moles are irregular or abnormal. We don't contract with any insurance, and so it's important to know that this is a pretty straightforward thing to remove a mole from a face. Most board-certified plastic surgeons can do it. So it's something where, as much as we'd love to take care of you and have you pay us out of your pocket to do that, you're probably going to be able to have that covered by your insurance and have another plastic surgeon do it and probably get a really nice result either way. But of course, we'd be happy to see you if that's what you want. There's one other question I thought was really...
Someone said,
Oh, yeah.
guys, best surgeon ever. 5 years since my breast dog and still look amazing. Thumbs up, thumbs up.
Oh, that's great. Thank you for saying that. We wanted to go live with somebody at one point. I don't know if anyone wants to go live. If you do, we can do it for about 5-10 minutes here before we head out for the day. But if anyone wants to go live, and I'm happy to chat with you. There was another question I saw. Oh, I can't blank. Let me see. Where does it go? Where was it? Let's see. We do that. I think I must have missed it. I don't know why I'm missing it. So overall, we've been doing great. We've been really happy with everything that's turned out. One of the things, that's what I was going to talk about. A lot of patients have been asking about what kind of precautions and protocols we're doing now in kind of the COVID-19 era. We've spent the last 2 months really collecting a lot of data and putting together policies, primarily our nurse manager and our anesthesiologist, on how to create the safest environment for our patients. I think it's worked great. Patients have been happy. We've been happy. Staff's been doing an amazing job. The surgeries are going about as smooth as they can, knock on wood. I've been really happy with it. Obviously, we tell all of our patients, if you're having symptoms, if you've been around anybody who's been sick, you need to let us know. We can always postpone things until you're feeling better. We don't want anyone else to get sick, and we don't want you to have an operation when you're feeling sick. So just let us know. But we've been really excited and happy to keep going, and we're just seeing lots of patients and taking care of everybody. So been excited. And I hope one final thing, the final quarantine cut, at least my wife's giving me 3 now, and it's I think it's looking pretty good. She's getting pretty good at it.
It's your new look.
It's my look. Thankfully, she says it's good for her that I'm not that picky, but I think she's actually doing a pretty good job. No big. I told her don't lose an eyebrow, and no big bald spots. But otherwise, it's been pretty great. So, any other questions we have there?
The one who was asking about the tummy tuck said thank you. And do you recommend any laser treatments to scars for a tummy tuck and/or breast lift?
Yeah, I think it's. Only if you need it. Usually, patients don't need it, and if you give your body enough time, it should just the color will come out of it. It may take I tell folks minimum a year. It takes about a year for the color to come out, sometimes a couple of years. But once you get to about a year or two, and if there's still a little bit of darkness, I would have you see a dermatologist to review your options for laser resurfacing. I don't do any lasers. I work with some great dermatologists in town who are just fantastic at what they do, and I leave that to the experts. And so, but yeah, there's definitely some things that can be done to soften the scars for sure.
Is there a protocol for the pre-ops? We have someone coming in for a pre-op on Wednesday. Is there anything that she needs to bring with her, be aware of?
Our staff will definitely call you and talk to you about that. But the short answer is, just like anyone who's coming into our office, we want to make sure you're not having symptoms, you're feeling well, you're going to wear a mask, you can get your temperature checked before you, right at the front door, make sure you're okay. We'll all have masks on. There'll be a lot of hand washing, of course. We try to limit the amount of time that you're physically here for your safety and also for ours. We also don't allow caregivers to come with you. That's why Olivia worked so hard over the break on these videos that are on our YouTube channel that show step by step the things to expect, all the things that basically you would be going, we'd be going through with you at the pre-op. They're there so you and your caregiver can review it as well. And then the other thing I think it's important for you, just in terms of your safety, we really are limiting the number of visits that we're seeing. So we don't want a bunch of folks sitting in our waiting room. I don't think it's safe for them or our staff to kind of congregate like that. So what you'll notice when you come in is that there's really no waiting room. We're spacing out our visits really far apart, so that basically you come in, You get your temperature checked, you get a mask on, you go into an exam room, I pop in, see you, or my nurse pops in and see you, and then we get you on your way. So we've really been happy about that. And if you have any other questions, though, just call us and we'll happy to go over it with you.
Someone said, I'm seeing some definition in my abdomen after the skin was pulled tight. Will that definition be lost, or how long before it comes back?
I'm assuming they mean after a tummy tuck.
Mm-hmm.
I mean, if you're seeing definition after a tummy tuck, that's great. And I think that as long as you maintain your weight and your diet and exercise protocol, there's no reason to think that the surgery would somehow, the result would change and now you wouldn't see that. Usually the definition, I love to think that it's all us, that we create all this definition for patients, but the reality is it's a combination. It's the surgeon, but also the patient in terms of their lifestyle habits, their diet, their exercise. It's whether we operate on you or not. I think I know a lot of trainers say that abs are made in the kitchen, not in the gym. I think it's true. I think that's where you're going to see it. But if you have some now, that's great. Just kind of keep up whatever you're doing, and it should stay with you for a while.
When is the soonest that someone can return back to a receptionist job after a rhinoplasty?
Oh, yeah. I mean, I tell folks at a week you'll be able to sit down at a desk and work, but you may not feel comfortable doing that, certainly as a receptionist, just because depending on how you bruise and swell, you'll have variable levels of bruising and swelling, so you may not feel comfortable doing that. So I tell folks maybe 10 days, 14 days before you really feel comfortable doing that.
And then we have a question for a cost of a mommy makeover.
Yeah, I mean, that's a really broad question. It depends on what we're doing exactly. Mommy makeover is sort of a generic term for combining several operations to address different areas of the body, typically in women who have either had children or sometimes had big changes in weight. Usually involves a tummy tuck or a body lift, some type of liposuction, and then something for the breast, whether it's a breast augmentation, a breast lift, a combination of the two. So it ranges widely. You can certainly call our office and talk to Rebecca, and she'll go over kind of the ranges. We feel like our prices are pretty much in line with the community. There's some things we charge a bit more for, some things maybe not quite as much, but more or less the same. There's nothing going to be, none of our prices are going to be outrageous compared to what you see in the greater Seattle area. Cool. Well, should give a shout out to Olivia. You guys should say hi to her and tell her thanks for putting all these together, because I'm otherwise pretty useless when it comes to this stuff. I hope everybody's safe. We'd love to see you whenever you're ready. We're continuing to do virtual consults for folks who would rather do that and not drive in or come in, and then we can see you in person whenever you're ready to go. So whatever works for you. Thank you, Seattle, and stay safe. We'll see you soon.
Quarantine wave.
Quarantine wave.